Joining us on the show now, Dr. Soumya Swaminathan, Chief Scientist at the World Health Organization. Dr. Swaminathan, thank you very much indeed for being with NDTV. Globally, the WHO is now saying COVID cases are declining, in fact, by nearly 25% last week. Does that give us hope that there is light at the end of the tunnel?
Thank you, Ankita. Yes, I mean, it's an encouraging trend that globally cases are declining, but we have to see it in the light of the fact that many countries have also reduced testing, and also many more countries are using self-testing or home testing, which is often not being reported. So one can't always go exactly by the numbers. However, we're also seeing a declining trend in hospitalizations and deaths, which indicates that things are going in a positive direction. And the reason for that is that we have increasing percentage of the world's population that's vaccinated. 65% of the global population has had at least one dose of the vaccine, and over 50% with 2 doses. And that's definitely helping to reduce the at least the severe cases and the deaths. We are, of course, can't say that this will continue to be on a decline, because we've seen in the past, we've experienced in the past that we've had these declines and the troughs, and then again there are surges. But hopefully the surges in the future will, even if there's an increase in infections, it should not translate into the same degree of severe disease needing hospitalization.
Would you say that what we're likely to see in the months ahead perhaps are ripples rather than the waves we've seen in the past? Or is that an oversimplification?
Once a virus is firmly embedded in the community, or it has become endemic as it has in many parts of the world, the factors that will make the infections rise and fall will depend firstly on the virus itself, whether it is changing, adapting, evolving, the so-called variants. And we've seen even within the Omicron lineage that we've had BA2, which is now the dominant variant. We also have BA4 and BA5 reported, and also sub-lineages of the BA2. And some of them have advantages and may become dominant strains later. But luckily, they seem to be behaving clinically in the same way as the Omicron. So one is the virus. The second is the waning of the immunity. As time passes after people have had their shots, there is, we know, a waning particularly in the antibody levels. And this means that they become more susceptible again to infection or even to reinfection. And the third factor is the behavior of people. So the more there's mixing, and particularly if there's mixing without masking, without paying attention to all of those things we know prevent the infection from spreading, if all those precautions, if they are dropped, right, then the chances of increasing infection are more. So when you see these three factors playing out in different ways in different places, you will see increasing and decreasing infection rates.
Right. But how far, Dr. Swaminathan, are existing vaccines actually giving us protection from these subvariants? What sort of data do we have at this stage? Are our existing vaccines really giving us enough protection from these subvariants? Are there any new vaccine tweaks on the horizon?
Yes, I think that's a question that everybody is interested in knowing. I think we've been very fortunate that the vaccines that were developed based on the original strain of COVID have so far provided protection against severe disease and death, against all of the known variants of concern, and including against Omicron. So that's really positive news. And we continue to track vaccine effectiveness, and we should continue to track vaccine effectiveness because there are also many different vaccines that are being used across the world. So we need to ensure that this data is collected and reported. However, what we saw with Omicron is because it's able to evade the vaccine-induced immunity and even natural infection-induced immunity to a much larger extent than previous variants, we saw many more infections in fully vaccinated people occurring with Omicron. But luckily, that did not translate into severe disease. So a lot of people experienced infection, but a much, much smaller proportion of people actually got sick or ended up in the hospital as compared to, say, Delta when a lot of people were not vaccinated. So I think that it shows that the vaccines are actually still working against the important clinical outcomes, but not so well against infection. And we don't know what future variants are going to do. So we need to prepare, and that's why many companies are already working on variant-specific vaccines. And we are looking very closely at the data, especially on what happens after somebody who's vaccinated gets BA1 or gets BA2, what's the cross protection. And there's a committee at WHO that's looking into this and will make a recommendation, I think, in the next 6 to 8 weeks on whether the virus strain that goes into vaccines need to change or not.
All right, that's a very important point that you're making over there. The WHO then looking in very closely at these subvariants and whether they have in fact whether existing vaccines give protection. But on the subject of vaccines itself and existing vaccines, why has the WHO decided to suspend Covaxin procurement? You've also talked about how countries using Covaxin can now take action as appropriate. What does that mean? For instance, India, which has used Covaxin extensively, what should people who've taken 2 doses of Covaxin now do?
So first thing I'd like to reassure people who've taken Covaxin is that there have been no doubts at all raised on the safety or efficacy of the vaccine. So those have already been shown and confirmed through clinical trials, and the reason why the emergency use listing was provided was based on those data. So I think first thing, do not worry if you've taken Covaxin. It is a good vaccine. It does what it's supposed to do. It works and it is safe. The reason why the WHO has provided this guidance is because when a physical inspection was done, which was not done at the time when the EUL was issued, there were certain points that were discovered in the manufacturing practices, which, the compliance with good manufacturing practices, which needed to be addressed. And many of these are around the automation of processes, so going from manual to automation. And because at the beginning there was a need to really start manufacturing the vaccine quickly to provide for the demands, some of these processes probably were delayed a little bit. And so it's a question of the manufacturer who has already taken note and has already been extremely cooperative and has addressed all of the issues. And there is a document which is called the CAPA, which lists all the corrective actions that need to be taken. So I imagine that Bharat Biotech is in the process of doing that. So it's a matter of time before those issues are addressed and it can be restored. But in terms of India or any other country getting worried or about taking any other action, I think that's not an issue at all. I don't think the WHO has
So if these
expressed any
corrective
concern.
steps are in fact taken, Dr. Swaminathan, could the WHO reverse its decision?
Yes, absolutely.
All right.
It's a question of just meeting those requirements, and the company is already in close discussion with WHO and is addressing all of those issues.
Right. Now, it's obviously a big relief that adults in India can now get the third or protection dose. Does India now also need to consider reducing the gap between the second and third doses, currently at 9 months, but globally the gap seems to be much lower. So does India need to sort of look at perhaps reducing that gap between the second and the third dose?
Well, I think this decision has to be made based on the data that's being collected in India. As far as WHO is concerned, I think our recommendations say that anytime 4 to 6 months after the second dose, the third dose can be given. And as you know, we've again prioritized the groups which need the third dose, starting from the elderly, the vulnerable, those with underlying conditions, healthcare workers, etc. But then we have said the third dose could be given to all adults, which is what India is actually doing now, recommending now. The gap, it doesn't really matter if it's 6 months or 9 months. But again, I think this is based on the data. It should be based on the data, particularly looking at are there breakthrough infections happening, which age group, so that you get indications of waning immunity. And, we have to remember a large part of India also was exposed to natural infection.
Right.
And so people have had 2 doses plus probably an exposure, which also boosts immunity. So I would, let the decision makers look at the data and make that decision on whether to keep it at 9 months or to reduce it.
Dr. Swaminathan, as several states are now forced to bring back the mask mandate as cases start to show an upward trend. In hindsight, was it a mistake to do away with it? Has this largely been responsible for the current uptick that we're seeing?
I believe that the strategy should be really to educate people on why and when and where we should be wearing masks. I think that mandates sometimes have the opposite effect of people wanting to comply because it's a rule and then not comply because it's no longer a rule. And we've seen this in other countries. And that should not be the case. The reason why masks are recommended in certain situations, particularly in indoor crowded settings, cinema halls, public transport, aeroplanes, shopping malls, is because the risk of transmission of the virus is much, much more when you're in a crowded place with many people talking, laughing, shouting, and when there is not good ventilation. So if people understand that this is the reason, they're not only protecting themselves, that they're protecting others, and they're protecting vulnerable people at home. So just because you're young and healthy and you've been vaccinated, probably you feel that you're not at high risk, but you may have a mother or grandmother at home who is still very vulnerable despite everything, So this is the reason why people need to continue to exhibit safe behaviors, is to protect their own health.
Dr. Swaminathan, then in the foreseeable future, do you see us living with masks as we live with the disease, perhaps for the next few years even?
I do. And you know why I'm saying that? Because we've seen in the last 2 years that the use of masks and other hygienic measures that we've adopted has reduced the worldwide burden of influenza and other respiratory infections. And many people may not know that every year, 500,000 people around the world approximately die of influenza, and hundreds of thousands die of other respiratory infections like respiratory syncytial virus, which also kills young children. And so by taking these protective measures, we're reducing the transmission of all respiratory viruses. And I think if you look at the behavioral pattern in many East Asian countries, they routinely wear masks. You see people in public spaces wearing masks. If you have a cold, you wear a mask, or you don't go out at all, you stay at home. And if you are in a crowded place, you wear a mask. It's just like we do hand washing.
What about airlines, for instance, in the United States and the United Kingdom, now that the mask mandate has been removed from airlines? What is this going to really mean for the immunocompromised?
It's what I was saying, that every time you limit, remove precautions, increase the risk of transmitting of the virus, it is the immunocompromised, it is the elderly and the vulnerable who will be paying the price. And it's our healthcare systems, because our healthcare systems will again get overloaded. And so the long-term goal of this pandemic, we're not going to get rid of the virus. We are going to live with it. It is going to go up and down. If we don't have another bad new variant, we can manage this with the tools we have. We're not in the same situation we were in 2020 or even in 2021. We have drugs now, we have diagnostics, we have vaccines, and we know how to manage this if people get sick. So we should look at it as part of a holistic and integrated approach to providing healthcare, particularly for respiratory infections. I think we need to integrate COVID management now into how we deal with other respiratory infections. Like flu, it's one more that we will deal with. And of course, we have to keep surveillance, because we do not want to lose sight of what is coming and what the situation is on the ground. So both in terms of regular surveillance, but also in terms of genomic surveillance, which needs to work, in a globally coordinated way. But I think that some of these practices like hand washing, wearing a mask, are some things that we should probably adopt into our regular lifestyle.
Adopt in perpetuity. One last question, Dr. Swaminathan. India says it's shared concerns about methodology used by the WHO to compute deaths globally. And in fact, it says there's been a series of formal communications, including 6 letters to the WHO. What really are India's concerns, and why do you think there have been such glaring differences between India's own estimates on deaths and that of global statistical models?
So I would just like to say that we should wait for the report to come out. It's not been officially released, and therefore a lot of speculation about what the report contains. So let's have this discussion when the report is out. Just to say that, WHO regularly puts out global statistics on different diseases, on incidents and deaths, due to all kinds of all health conditions. It is the global repository of data in cases where there is actual real data that is used. In other cases, a modeling is used or a mixed approach is used. And what is being estimated here is excess mortality, which is the overall increase in deaths as compared to historically what one would expect. So these are not all COVID deaths necessarily, but they may be deaths due to a number of other conditions which happened during the pandemic, because of the challenges which people had with access to healthcare and so on. And a very good example is actually South Africa, that has a good system of collecting this excess mortality data. And if you look at their slides, you can look at the pattern. You see the excess deaths exactly coinciding with the peaks of the COVID waves. Part of it can be explained by COVID, and the rest of it cannot. So it is a difficult, complex topic to understand. So I think let's wait for the report to come out and then we can discuss it.
All right, Dr. Swaminathan, we'll take you up on that once that report is out. Thank you very much indeed for speaking with NDTV.
Thank you.